Okay, good day everyone. We are going to be discussing about your diabetes mellitus as well as the complications that are anticipated when there is no proper management and care of our patients. So we have here your DKA versus your HHANS. I'm going to be discussing that one later, but as a preliminary, a primer to our endocrine gland disorder, okay, there we go. So, what is your DM, or your diabetes mellitus? It's a chronic disorder of impaired carbohydrate, protein, and lipid metabolism, which is caused by a deficiency of insulin. So, actually, we have two types. We have your DM type 1 and we have your DM type 2. And then, we also have here your absolute or relatively deficiency in your insulin, resulting in your hyperglycemia. So, if you're going to be referring in reference to our discussion about your anatomical structures and your anatomical function of your endocrine, this is basically your pancreas, the islets of your Langerhans, which has your beta cells, which is responsible for the release of your insulin. Okay, your insulin. So, in this case here, your DM is chronic. Pag sinabi natin chronic, it's long-term. And really has something to do with your carbohydrates. It's your sugar metabolism that is the problem here. And because there is your sugar metabolism, likewise, we can attribute your lack of insulin as one of the reasons why we have your consistently high levels of your glucose in your blood, or we can have that your chronic hyperglycemia, or there could be another reason, which is your decreased sensitivity of your cells to your insulin. So, again, ulitin natin, yung mga keywords natin dito is your sugar plus your lack of insulin, or decrease in the sensitivity of cells to your insulin. So, that's basically it. I hope you understand what your insulin does to your body. Paulit-ulit na lang ito. This has been discussed in your biochemistry. It has also been discussed in your pharmacology. And it has also been discussed in your NCM 112. So, your insulin is very important in the transport of your sugar inside your cells, so that your cells will not have any problem with starvation, or there would be continuous metabolism that's going to happen. So sugar is needed by your cells so that you can have your ATP. However, your sugar cannot enter the cell without your insulin. That's the basic concept that you have to remember when we are talking about your diabetes mellitus. So insulin is very, very important. Okay, so as you can see in the picture, you have there your glucose in the blood. This is the normal or the healthy distribution of your glucose, and we have here on the second picture excessive glucose in the blood. So ganyan kadami ang circulating glucose in the blood, would obviously that would have an effect on the blood plasma that is circulating in your system. That's why we are going to be talking about your manifestations later on. So, type 1. Ano bang difference ng type 1 at type 2? Type 1 diabetes mellitus is nearly absolute deficiency. Okay, let me put a box on that one. Absolute deficiency of your insulin, specifically that your primary beta cell is actually destroyed. So, without your beta cell, or if there is your destruction, mostly of your beta cells, then therefore, there is no production of your insulin. And no production of your insulin would mean na hindi makakapasok yung sugar doon sa cells natin. So, what will your body do? It will try to compensate and look for ways so that the body can still achieve your energy, and that would mean the usage of your fats, okay, to metabolize your energy. Unfortunately, yun nga, it might end to your acidosis or your ketosis. Okay? Familiar yung mga ketogenic diet natin. No? We'll be discussing that one. If this actually applies to patients who have your DKA or your diabetes mellitus. Okay? In some healthy individuals, it is fine to have your ketogenic diet, but for patients who have this type of disease, it's very dangerous. Okay? So, again, I would like to emphasize that without your insulin, your glucose cannot enter your cell. And when there is no glucose entering the cell, there will be no metabolism. There will be no generation of energy. So, ang pasyente natin, ano yun? Very weak. Okay, very weak, body malay, patient will also be lethargic, and there will be hypoglycemia. So, that is your type 1. Absolute deficiency of insulin. Now, let's go to your type 2. Type 2, diabetes is a relatively lack of insulin or resistance to the action of your insulin. Okay, resistance to the action of your insulin. So, yung insulin mo, marami naman. However, okay, your glucose, your tissues do not accept it as expected or as anticipated. So, there is your resistance to the action of your insulin causing you to have your problems in glucose metabolism. There would be not much of your glucose entering the cell because, yun nga, ayaw ng cell mo eh. They are resistant to the action of your insulin. So, there is enough, okay, there is enough insulin, however, there is resistance of the cells. So, as you can see, you have your insulin there, there's your glucose, and your insulin receptors in the tissue cells or in your cells, ayaw nila. They refuse to accept. Cells fail to respond to the insulin properly, causing you to have your hyperglycemia. So, that is your type 2. Gary Valenciano has type 1. So, in order for him to continue on and be that energetic in front of the cameras or in performance of his activities of daily living, he needs to have your insulin shots. As compared to type 2 diabetes mellitus, wherein there's no need for your insulin shot. You just need to have a oral hypoglycemic agent to decrease the level of your glucose. Okay? That is, the basic understanding of your type 1 and your type 2 diabetes. Pero kapag magkakaroon ka na ng complication, ibang usapan na yan. Okay? And we will be going to that later. We will delve into that later. Okay? So, ayan. Comparison of your type 1 and type 2 diabetes. The onset is kung kailan siya nangyayari. Or when you experience this manifestations, how is it? How does it happen? So, the onset for your type 1 diabetes is talagang agad-agad eh. Agad-agad. Because you lack your insulin. And if you try to eat a lot of things and you do not have insulin, it's quite dangerous because you're going to die. You're going to die of cell starvation. That's what's going to happen to you. Your type 2 diabetes, by the way, your type 1 is also called your juvenile DM. Because patients who have your type 1 diabetes start manifesting signs and symptoms at a younger age. So, juvenile kasi nga, bata pa lang, alam na nila na meron silang DM type 1. When you have your type 2, this is highly associated with the lifestyle of the patient, his upbringing, his type of diet, etc., etc., or maybe even his hereditary disposition. So, type 2 diabetes is actually gradual in onset. Medyo matagal siya before it actually manifests. So, that's one difference for type 1 and type 2. Age of onset, I've mentioned, mostly in children, and type 2, mostly in adults, because we associate that one with the environmental factors and his lifestyle. Body size. Type 1 diabetes patients are thin or normally built. Now, they are not stout or obese as often observed with type 2 diabetes patients. Bakit sila payat? Kasi, ang kulang sa kanila is your insulin. Without your insulin, you do not expect glucose to be metabolized. So, every now and then, they need to have that insulin. As in talagang injection every now and then. As compared to your diabetes mellitus type 2, ang problema ng mga patient na ganito is that it's actually asymptomatic at first. Until such time that, boom, you have the disease already. Until such time that you have the manifestations and you have the laboratory findings. Kaya, they think that it's okay to actually eat a lot of these carbohydrate-rich foods and all of these things. They think that they're fine. However, they're actually not. Because sugar level is just going up the scales and it's just elevating without them knowing about it. That's why, kapag dumating na yung time, once they are diagnosed to have that one, that's the only their only recourse there is your medication. Okay? So, wala silang pakialam eh, kasi nga, it usually starts asymptomatic and then, when you're diagnosed, doon mo na lang malalaman na, okay, it's too late. You already have your diabetes mellitus and you already are in this particular body size. Okay? Next, we have your ketoacidosis. For patients who have your type 1 diabetes, one of the complications there is that since you do not have your insulin on hand or innately, ang katawan mo, it's going to look for ways and means on how they can generate energy. And the way or the manner that type 1 diabetes mellitus patients actually would have that energy is through the use of your fat metabolism. That's why a byproduct of your fat metabolisms are what we call your ketones. Okay, ketones. So, when you have your ketones, since it's a byproduct, marami siyang hydrogen. Kaya, we call it your ketoacidosis as a byproduct of that fat metabolism. Wala ka namang byproduct when you are going to have carbohydrate metabolism, di ba? Wala na shadow dyan. But when you have type 1 and there's no insulin, and there's no carbohydrate metabolism, and what you have is your fat metabolism, you will be expecting that with type 1, meron kang ketoacidosis or your ketones. Okay, positive yan. For your type 2, it's quite rare. Why? Kasi, meron ka namang insulin eh. You still have your insulin. There's still sufficient insulin. The only problem here is that your cells refuse to accept your function of the insulin. But you still have your insulin there. Okay, so it's quite rare. Next, another feature for the comparison of your type 1 and type 2 is that you have your autoantibodies. Okay, autoantibodies trying to attack your beta cells of the islets of Langerhans. Kaya, doon sa type 1 natin, they're usually present. Okay, however, in type 2, since meron ka pa namang insulin, it's non-existent at all. So, it's absent. Next, we have your endogenous insulin. Obviously, sabi ko nga, di ba, yung type 1, you do not have your insulin. There is near absolute deficiency of your insulin. So, you have very low level or absent insulin. And you have your type 2, it's normal, decrease or increase depending on the type of hyperglycemia that you are experiencing. So, that is the comparison of your type 1 and your type 2 diabetes. I hope you can still catch up on this. If you cannot, please read your books. I am giving you a gist or a nutshell of what your DM type 1 and type 2 is. Okay? You need to understand this quite well because ito yung mga klase ng mga pasyente na hinahawakan natin sa clinical area. Marami po tayong mga pasyente ganito. If not, in the hospital, at least you would know what to do when you are taking care of family members who have this disease because this is one of the most, common or frequently observed or experienced or afflicting Filipino citizens in the country. Actually, if I'm not mistaken, is a part of the top 10 morbidity disorders in the Philippines. Okay, so at least you would know and try to understand. So how do you try to diagnose or how do you try to evaluate if the patient really indeed has your diabetes mellitus? So we have your oral glucose tolerance test. I have explained this one already before when we were talking about, kalimutan ko na kung anong discussion yan. Basta endocrine, I think. Basta, diniscuss ko itong oral glucose tolerance test. You have your 2-hour post-load of the glucose level, I think for each time that you are given your sugar intake, you need to be extracted of the blood, and then for if I can remember it correctly, every 30, 60, 90, and 120 minutes. Okay, so you are going to be ingesting your glucose of higher than 200 milligram per deciliter. This is to confirm the diagnosis of your diabetes mellitus. Most importantly, this is also done among your pregnant women who is suspected to have your gestational diabetes. Next, we have your fasting blood sugar or your FBS, or your RBS. So, again, to blood extraction lang to eh. Tapos, obviously, prior to your blood extraction, you're going to have NPO. NPO 8 to 12 hours or maybe post-midnight prior to your blood extraction for your fasting blood sugar. And the normal is less than 100 milligram per deciliter. So, that's 5.6 to 5.6 millimole per liter. And then you have your pre-diabetes mellitus, 100 to 125 milligrams per deciliter. This is not the same as yung ano natin CBG monitoring ha, iba ito. Okay, your CBG monitoring is only in your peripheral, but this one needs to be taking, you need to be taking blood samples here. I mean, more than the ones you stick in your finger pads. So, pre-diabetes, you have 100 to 125 milligrams per deciliter. Yung range na in millimole. is 5.6 to 6.9 pre-diabetes. Nakakatawa kasi dito sa sa annual examination namin, biglang ang dami naming pre-diabetes na mga clinical instructors, not only clinical instructors but employees. Doon lang namin nalaman, we can attribute that one to binge eating during the quarantine last year and even this year. So, PDM na kaming lahat, 100 to 125 milligrams per deciliter. And then, FBS again, with a higher level or value on two separate tests, 126 milligram per deciliter, that's 7 millimole per liter, or higher than that one, you are confirmed to have your diabetes mellitus. So, usually, ang sinasabi ni Doc dito is, PDM pa lang, binibigyan ka na ng oral hypoglycemic agent or medications which try to decrease your hyperglycemic episodes para you need to control it. And you have to take it for like 3 months. And then afterwards, you're going to have your re-evaluation for your fasting blood sugar to check if there is indeed a regulation of your sugar level. If it's not regulated appropriately with the medication that is given to you, then the doctor is going to add more medications until such time that you can control your glucose level. Kasi kapag hindi mo na-control ito, yung complications na mangyayari sa'yo, mamaya, i-discuss natin yan. Talagang that's going to take a toll on your body. Okay, next, urinalysis. With your urinalysis, dapat wala kang makitang sugar doon, di ba? Kaya lang, kapag meron kang nakitang glucose doon in the form of your glycosuria, okay, because that's your glucose in your urine, and you have your ketone bodies, that's a red flag. It means to say, oh my gosh, you are diagnosed to have diabetes mellitus. Okay, so normal level is 0 to 0.8 millimoles per liter. More than that one, that's a red flag. Next, you have your glycosylated hemoglobin test, or this is what we call your HbA1c. Your HbA1c, I think I have discussed this one. Your HbA1c provides information about how well you have managed or controlled your sugar level in the past 3 months. Kasi nga, hemoglobin test. Your hemoglobin has a lifespan of 3 months. Diba? 120 days. So, it's also in that manner that the laboratory can confirm information that the person or the patient who has your DM is able to control, okay? Control the level of your sugar for the 3 to 4 months span. Kasi doon mo malalaman from your hemoglobin which has a 3-month lifespan. Doon mo makikita, hindi ka pwedeng magsinungaling dito kasi ipapakita talaga kung gaano ka kaseryoso or ka-religious to follow your doctor's protocol in decreasing your carbohydrate intake and at the same time your compliance to your medication regimen. So these are your diagnostic procedures in finding out and confirming if indeed the patient is suffering from your diabetes mellitus. Now let's go to your pathophysiology of your diabetes mellitus. Sabi ko nga kanina, insulin is the problem here, right? So if the amount of insulin available is insufficient, then that's a predisposing factor. If the cells are unable to respond appropriately to your insulin, then that's also a problem. And if the insulin itself is defective, I mean non-existent, then that's where your problem actually originates. So because there's not much insulin, because there's poor response of the cell to your insulin, and there is destruction of your insulin, then your body, since it really needs to have your energy, will continue to produce, or when you are that kind of person who tries to intake a lot of carbohydrates, your glucose will just increase, okay, in your circulation without it being absorbed. Hindi po siya nakakapasok sa cells natin. It will just be circulating all over your body without any direction at all. So then the glucose will not be absorbed in the body cells. Therefore, anong effect noon? Your cells are going to starve. Okay? Your cells are going to starve. And because there is self-starvation, your body is going to find ways. I mean, it is a negative feedback so that the body will try to attempt in achieving energy even without glucose. So what will happen is that there will be high levels of blood glucose but poor protein synthesis. Okay, poor protein synthesis, and their only recourse to resolve the problem is to use your fats. So breakdown of the fats. And because there is a breakdown of the fats, I've mentioned earlier that the byproduct of that is your ketones. And with your ketones, it's a high level of your hydrogen. So you will have your acidosis, specifically your metabolic acidosis. Okay? Yun yung nangyayari dyan. And when the glucose concentration in the blood remains high over time, kasi nga, yes, there might be instances na hyperglycemic episode one time and then normal ulit, tapos ganun. But for instances such as patients who have your DM type 2, where it is chronic, where it is asymptomatic, initially, but, since you did not do something about that, and you have not changed your lifestyle and your diet, so, nag-accumulate yung sugar level mo in very high values. And the repercussion here is that your kidneys might be affected. So, the kidneys will reach a threshold of reabsorption. It's going to destroy the very viscous blood with a lot of your sugar. Is going to destroy the permeability of your kidney tubules, and it will cause you to have your glycosuria. How is that going to happen? You will have your osmotic pressure. Remember, your osmosis is the movement of your fluid to an area of lower concentration to higher concentration. So, ang nangyayari dito is that since there is high concentration in your renal tubules with your viscous blood of which has a lot of your sugar in your blood, okay, in the kidney, you are going to have an increased osmotic pressure, which tries to suck in, which tries to pull in and draw in as much fluid, okay, outside of your system. So you end up having your polyuria, and you end up having an increased fluid loss. It's one of the 3 P's, by the way, 3 P's of your hyperglycemia. Number 1 of that is your polyuria. Kasi masyadong mataas yung osmotic pressure natin, so talagang hinihila niya yung ating fluids palabas doon sa ating kidneys, palabas sa ating system. Initially, there is reabsorption of fluid, but because there's just so much sugar, there's just so much concentration, okay, in your kidneys, in your renal tubules, hinahatak niya pati yung fluids. So, because hinahatak niya, because fluid is drawn out and pulled out, you end up having your polyuria, and because there's so much of that happening, you also end up having your loss of your blood volume. And because there's your loss of your blood volume, again, this negative feedback mechanism would indicate the body to do something about that. Hey, your brain's telling you, oy, bakit kulang na yung blood volume natin? Why do we have less than the blood volume as before? So, what it's going to do is to tell, again, your hypothalamus, hoy, you need to do something about that because we're losing a lot of fluid here. So, what will happen is that, kasi nga, merong a lot of fluid loss, right? So, that's basically equates to your dehydration. And because that's happening, your hypothalamus is going to be triggered, and then it will teach you, or it will actually lecture you, you need to drink a lot of water. So that's why you have your polydipsia, as a result of that polyuria that's happening to your system. So polyuria, okay, and because there's a lot of polyuria, you have your loss of your fluid, there is your blood volume that's lost, and your body is going to attempt to have, to resolve your dehydration. That's why you have your polydipsia. Okay? Kaya yung mga pasyente natin na mayroong DM, palagi silang umiinom, palagi silang umiihi, because, yun nga, nade-dehydrate sila as a result of that destruction of your renal tubules and your increased osmotic pressure. I hope you can still remember our discussion about your osmotic pressure, ha? Sana hindi nyo nakalimutan yun sa fluid and electrolytes. Okay, let's go to your signs and symptoms of your diabetes mellitus. So, in your CNS, you have your polydipsia, your polyuria. Okay, another letter P of your diabetes. So, sabi ko nga kanina, di ba? You have your 3 Ps. Specifically, this is for your hyperglycemia. Okay, you have your polyuria, polydipsia. Okay. You have your polyuria, polydipsia, Last but not the least is your polyphagia. Why do we have polyphagia in patients who have your diabetes mellitus? Hindi ba, I've explained it to you earlier that a patient who has your DM does not have enough glucose metabolism. And without glucose metabolism, you end up having a starved cell. Now, there is cell hunger. Basically, hungry ang cell natin kasi nga, they don't receive enough of the glucose. Because there's, number 1, less insulin, and number 2, insulin resistance. So, ang patient na may DM will try to attempt to get as much energy as it can. So, yung negative feedback mechanism dyan is, the body will tell that patient, hey, you need to eat because we're starving here. You have to do something about that. That's why we have your polyphagia. Kakain siya kakain kasi nga, yung glucose kailangan ng cells mo. Unfortunately, that's not how it works. With your DM, you might be eating a lot, but your glucose still remains in your circulation and not in your cells. Okay, so it's like a cycle. It's on loop. Paulit-ulit na lang yan. Kasi nga, hindi mo na correct yung problema doon sa insulin natin, and you did not also correct the problem in your insulin resistance. So in order to correct or in order to treat this one, you need to go to the root cause of the problem, and that is to provide your insulin and to do something about your insulin resistance. But anyway, that's how it is when we're talking about your treatment. And let's go back to your signs and symptoms. So because there is cell starvation, there will be LOC changes. As you can see in the concept of your lethargy and your stuporous behavior of the patient, client will also have your blurred vision. This can be attributed to your complications such as your diabetic retinopathy. Pwede po yan. Remember that your eyes have very, very fine and minute, very tiny circulation and veins or vessels. So if you end up having very high levels of your sugar or your glucose in your system, it's also going to affect the circulation that reaches your eye. Again, problem ng osmotic pressure natin dito, it's going to also be affecting your ocular organ or ocular system or your circulation there. So, patient might be suffering from your blurred vision. Okay? Next, we have your systemic. You will have your weight loss. Bakit weight loss? Kasi nga, this can happen for patients who have your diabetes type 1. Kasi nga, without your insulin, they will remain to be thin, very frail, because they don't have enough energy. In like manner, for your DM type 2, mangyayari yan kapag naging complicated na yung DM type 2 mo. Wherein, yung insulin resistance mo, it's not just only insulin resistance that is the problem, but it also includes your lack of insulin. Meron tayong mga cases wherein your DM type 2 can have an additional manifestations of your DM type 1. Nagets? Kasi DM type 1, problema mo, insulin lang talaga. But with your DM type 2, if it becomes really serious and it becomes worse and it becomes more complicated, it's not just your insulin resistance that's going to be the problem there, but also yung ating lack of insulin. Kasi nga, nag-evolve na yung sakit mo eh. Pang matagalan na, it's chronic already and you have not done anything about that. So you end up having your weight loss there. Okay, next, respiratory. Kussmaul's breathing is your hyperventilation as a form of compensatory mechanism. Kasi nga, there's just so much of your metabolic acidosis that's happening in your system. So, in order for that patient to control or to regulate or to manage your metabolic acidosis, nilalabas niya yung ating acidosis through your breathing. Remember, in the concept of your arterial blood gases, your ABGs, your acidosis and your alkalosis, dalawang organs ang involved dito. It's your kidney and your lungs. Now, kapag meron kang diabetes mellitus kasi, one of the target organs there for your complicated case of your DM is your kidneys. Okay? And like manner also, when you have your fat metabolism or your ketoacidosis, there is also your metabolic acidosis. So, para ma-resolve yung issue ng metabolic acidosis, magkakaroon ka ng hyperventilation Okay, hyperventilation kasi you would like to remove these excess carbonic acids out of your system. So that's why we end up having your Kussmaul's breathing, the hyperventilation. Okay? And then next, you have in your breath, if you try to smell or try to come closer to a patient who has your DM, especially those who have your complicated case of your diabetes mellitus, maaamoy mo na parang meron siyang fruity odor doon sa paghinga niya. And this is again a sign and symptom of your metabolic acidosis. Okay, so there is your smell of your acetone or fruity breath. We call it your fruity odor, fruity breath coming out of the patient's mouth. That's a lot of sugar there. Okay, gastric system, you have your nausea, you have your vomiting, you have your abdominal pain. In your urinary, you will have your polyuria and your glycosuria. Anything that has something to do with your hyperglycemic episodes in your diabetes mellitus. Okay? So those are our signs and symptoms. Now, management of DM, it's fairly easy. Okay? Because, I mean, yes, you can control it. And this is a point of, treatment wherein you have your maintenance medication. So, number one there is medical nutritional therapy. Change of diet, you have to increase your exercise because having to do that, you will also decrease the levels of your sugar in your body. Another thing is you have your oral hypoglycemic therapy. Ito yung mga sinasabi natin, OHA. We call it your OHA. So your OHA will try to decrease levels of your sugar. This is applicable. This is the drug of choice for patients. Ay, sorry. Hala, bakit nandyan? Okay. Wait, let me erase that one. Yan. Okay. So, this is the drug of choice for patients who have your DM type 2. Yan. Kasi your hypoglycemic agents will will decrease your resistance to your insulin. So, if you decrease the resistance to your insulin, then you can accommodate already now your glucose into your cells because your insulin can now do its job appropriately. And then we have your insulin as one of the medications for DM. And this is the drug of choice for patients who have your DM type 1. DM type 1. Okay, that is your insulin. Okay? So, ito lang, tatlo lang. Kaya lang, mga pasyente kasi medyo matigas ang ulo eh. Hindi sila nagpo-follow ng ganito na protocol. So, you end up having what? Complications. So, this is, by the way, your dietary modifications. Day-to-day consistency in timing and amount of food, most especially that you need to decrease your carbohydrate intake. Okay, yung mga fruits natin, dapat yung protein, mga nuts, ayan o. Kita ko yung mga sunflower seeds, kung ano pa yung mga almonds, yan. Yan yung mga natin, type of foods that can be given to our patient. Again, your amount of food intake will actually help control your blood glucose level. Carbohydrate count, mga pinagagagawa ng mga nagda-diet saan, yes, they have your carbohydrate or calorie count. It's a simpler approach to decreasing your sugar level. Incorporation of your dietary or your lifestyle changes. For some of the mga groups that I see in Facebook, they say that your intermittent fasting can actually help you because it provides your body to rest on certain periods of the day so that it would not be accommodating as much glucose in your body. So, it's like a form of sugar control. Yung intermittent fasting natin. You can have your TMAD, you can have your OMAD. Ang dami ko alam pero hindi ko ginagawa. Ang hirap gutom palagi. Okay? You have your OMAD, you have your TMAD. OMAD is 1 meal a day. TMAD is your 2 meals a day. But it has your specific calorie count. Mga ganyan. Ayan. Okay.